Let's go ahead and get started. First of all, thank you all for participating in today's conference pre-virtual session. We took this to a virtual session recognizing that both our federal agencies and our state partners were sometimes having challenges traveling this year, and we thought this was such an important set of messages. It was important for you all to have an opportunity to hear from all of these folks, so we wanted to make this available in a virtual manner so you all had an opportunity to hear the discussion today. We will start with four speakers, and I'll introduce each of them at the beginning of the session. Each of them will have some remarks, and then we'll move into a joint Q&A session. For those of you that are going to ask me this question soon or in the chat any minute, yes, this is being recorded. Thank you for the permission from all of our speakers for recording. And we will be making it available to all the folks that registered and to the conference registrants. So it will be becoming available here later this week. So with that, let me go ahead and begin with introductions to this very esteemed panel. I'm going to begin with Kyle Diamantas, the Deputy Commissioner for Human Foods. Kyle leads the Human Foods Program at FDA, oversees all aspects of nutrition and food safety. In this role, he directs policy development, resource allocation, risk-based decision-making, and major response activities related to human food. He also oversees food-related operations within the Office of Inspections and Investigations. As FDA's top food official, he sets the national policy direction and acts as a key liaison to the Department of Health and Human Services, the White House, foreign governments, and international organizations. He brings extensive experience in regulatory affairs, compliance, enforcement, rulemaking, and the legislative process, and has worked closely with federal and state agencies, scientific organizations, consumer groups, and industry stakeholders. He holds a Juris Doctorate from the University of Florida, Levin College of Law, and a bachelor's degree in pre-law political science from the University of Central Florida. Our second speaker will be Dr. Elizabeth Miller, who is a PharmD, Acting Associate Commissioner for Inspections and Investigations. Dr. Miller just assumed the role as Acting Commissioner in OII, formerly ORA. She is a seasoned professional in regulatory excellence, public health, and medical product safety, and most recently served as the Deputy Associate Commissioner for Medical Products, overseeing OII's Medical Products Inspectorate. Combined with her prior position as Assistant Commissioner for Medical Products and Tobacco Operations, Dr. Miller has managed a large volume of FDA inspections related to drugs, medical devices, biologics, bioresearch, monitoring, and tobacco products. Her extensive background includes executive leadership positions at U.S. Pharmacopeia, where she helped shape regulatory science collaboration, public policy, and government affairs while working alongside federal agencies, industry leaders, and international regulators. She began her career at FDA's Center for Drug Evaluation and Research, where she led the Office of Unapproved Drugs and Labeling Compliance, Division of Non-Prescription Drugs and Health Fraud. Before her government service, she contributed to USP's medication safety standards and drug information initiatives and began her career as a clinical pharmacist in the hospital setting. She holds a Doctor of Pharmacy degree from the University of Maryland and a biology degree from the Johns Hopkins University. Our third speaker is Dr. Denise Eblen, Administrator of the USDA Food Safety Inspection Service, or FSIS. Dr. Eblen has served as Administrator of USDA's Food Safety Inspection Service since December 2024, leading the agency's efforts to protect public health through science-based food safety policies and inspection strategies. She oversees the implementations of FSIS's strategic goals, including prevention of foodborne illness, modernizing inspections, and improving operational excellence. With over 25 years at USDA, Dr. Eblen has held key roles in FSIS, including Assistant Administrator for the Office of Public Health Science, where she led scientific analysis lab oversight and outbreak response. She also served in leadership positions at USDA's National Institute for Food and Agriculture and the Agricultural Research Service. Dr. Eblen holds a PhD in food safety microbiology from the University of Ulster, along with degrees in food science and human nutrition from Queen's University Belfast and the University of Ulster. Our fourth speaker is Dr. Megin Nichols, a director of the Division of Foodborne, Waterborne, and Environmental Diseases at CDC's National Center for Emerging and Zoonotic Infectious Disease. She previously served as the DFWED's deputy director beginning in 2022 and has been with CDC since 2008, starting as an epidemiological intelligence service officer or an EIS officer. A veterinary epidemiologist and a diplomat of the American College of Veterinary Preventive Medicine, Dr. Nichols has led numerous multi-state outbreak investigations involving Salmonella and E. coli linked to animal contact. Her leadership and contributions to public health earned her CDC's Director's Award for Values in Action in 2024. Dr. Nichols holds a DVM from Colorado State University and an MPH in Food Safety and Biosecurity from the University of Minnesota, and a BS in Animal Science from New Mexico State University. She is widely published in the fields of food safety and One Health. We are very excited for this group of speakers, and let's go ahead and begin with Deputy Commissioner Diamantas' remarks.
Good afternoon, everyone. I'm very pleased to be speaking with you today. For many reasons, it's an exciting time to be working on food issues. Before I get into that, though, I want to start off by expressing my sincere appreciation to the AFDO community. You are a group of FDA partners and co-regulators who, for more than a century, have worked hand in hand with us to improve the safety and health of American consumers. Our continued partnership is as critical now as it has ever been because of the intense interest in foods and food and nutrition policy. The MAHA movement, led largely by parents across the country and coalesced by Secretary Kennedy, has created a paradigm shift in how consumers, industry, regulators, and legislators, both at the federal and state levels, are thinking about foods we eat and how they should be regulated. Fortunately, FDA has already taken action to respond to this growing interest in food. As many of you know, last year, the agency implemented a unified organizational structure with a new name, the Human Foods Program. This new structure breaks down silos in our previously fractured food portfolios and centralizes coordination and strategic leadership. It helps us better optimize the talent we have at FDA, while also ensuring our work with our partners is aligned with program priorities. Under this administration, we have a renewed vision that focuses on ensuring that food is a vehicle for wellness. To help achieve this, the Human Foods Program has been working to strengthen our risk management approach and prioritization through science-based approaches to prevent foodborne illness, reduce diet-related chronic disease, and ensure chemicals in food are safe. There isn't a more important place to focus implementing our new HFP operating model than the work planning cycle. For the upcoming FY26 cycle, we have initiated a more robust risk prioritization effort to help us effectively work towards meeting our inspection frequency mandates and ensuring our sample assignments are aligned with programmatic priorities. Driving this risk prioritization approach across our three risk pillars will ensure that we are focusing our resources on efforts where the intervention has the greatest opportunity for the prevention of disease and illness. And I want to be clear that the U.S. food supply is safe, period, full stop. But there are undoubtedly ways we can make it safer and healthier, and we look to you, our partners, to help us achieve that. Today, I want to speak to three themes. First, I'll share how I think we should be transforming our partnership to be more integrated in how we meet our shared food safety responsibilities. I'll also talk about leaning into the power of new data analytics to drive impact. And finally, the important role of information sharing underpinning our on-the-ground partnerships and our data analytics. As to partnerships, there's no doubt our partnerships with states have been the foundation of some of our most important work to ensure the safety of the U.S. food supply. We're constantly working on the front lines together to respond to outbreaks and emergencies and to handle food recalls, which ensure timely response to public health protection. It's through these partnerships and our tireless efforts to establish an integrated food safety system that we expand our public health reach and impact. One incidence of foodborne illness is simply one too many. Meanwhile, it's no secret that food safety at all levels of government has been historically underfunded for decades. With growing demands on our own limited resources, we know we must find new ways to expand our reach while maintaining FDA's rigorous national standards. And that's where you all come in. We're already engaged with you in food safety oversight through established mechanisms such as cooperative agreements, food inspection contracts, and partnerships. And I'm sure you all are aware now that the President's budget for FY26 includes an increase of $33 million to expand these current state agreements for routine inspections of domestic food facilities. We're encouraged by the support in the President's budget that would restore the previous levels of funding with the direction to use those resources in support of redefining our inspectional approach, one that further leverages the strengths of our state partners and transforms our shared oversight model. We believe this paradigm shift will allow us to work smarter together toward building a fully integrated, risk-based oversight model. We envision this model will promote efficiency and reduce redundancy, expand inspection coverage, increase surveillance capacity, and ultimately strengthen public health protection. The FY26 President's budget also proposes what would amount to about an 8% overall increase for the Human Foods Program in order to support MAHA initiatives. This would support advancing our work to ensure that the safety of chemicals in our food, including through the development and launch of a stronger, more systematic review process of food chemicals already on the market, and also by addressing additives in the post-market context through GRAS reform. With these additional resources, we would also be able to explore the potential to expand our Closer to Zero initiative to eliminate toxic elements, such as arsenic and lead, from foods commonly consumed by infants and young children. We also hope to use these new funds to invest in strengthening our nutrition program, managed out of our newly created Nutrition Center for Excellence. With additional funds, we can advance our labeling efforts in that space, which are powerful tools with dual impact of providing consumers with more transparent information about the foods they eat, while also helping stimulate an overall healthier food supply. We also are excited to embark on an effort co-led with USDA and on behalf of other government partners to establish a consistent definition for ultra-processed foods. We expect to post a request for information on this issue by the end of this month. Congress will ultimately need to provide this funding to FDA, but we're pleased it is reflected in the budget proposed and hopeful it will be appropriated by Congress in FY26. We look forward to working with you on this initiative and this path forward. Now, I realize it's a little hard to follow that discussion on resources and the exciting vision for the future of our partnership. That said, there are a few more critical topics I want to cover with you today that will be instrumental in the success of any new inspectional approach: data analytics and information sharing. In the Human Foods Program, we have seen game-changing possibilities come from innovative technological advancements. Think whole genome sequencing. Since the launch in 2012 of the Whole Genome Sequencing Network, over 1.5 million isolates have been sequenced, and we're now regularly sequencing over 20,000 isolates each month. Advances in whole genome sequencing and the environmental and clinical data being collected and tracked is allowing us and you, our state partners, to solve outbreaks in record time, uncover contamination trends, and ultimately put measures in place to enhance prevention. I'm also proud to say we are at another milestone point in leveraging companion technology, such as artificial intelligence, that we think will harness the power of new techniques to sift through enormous data sets to access new insights. Just as an example, the agency has begun applying these AI tools to samples collected by states over the past 5 years under the LFFM model. This innovative approach has allowed for more rapid identification of chronic risk versus acute risks, identity of our own coverage of national versus smaller brands, what market share we are hitting in our sampling efforts, and ultimately has helped FDA enhance our sample efforts with more efficiency. I'm personally very excited about our advancements in AI, and it's a key priority of mine to better utilize data captured during inspections, sampling, and other surveillance activities by using these technologies to help us detect signals, trends, and other findings that could help us better target resources and address blind spots. It's worth noting that inspections are an essential part of the work conducted by FDA and our partners. However, as you all know, inspections are quite resource intensive, and anything we can do to improve efficiency will be a game changer in our fight for better human health and regulatory oversight. We also see great success with these tools with respect to leveraging data and information we receive through third parties. We've been actively working with industry partners to foster such data sharing collaborations, and we hope those efforts will serve as a model for future partnerships across industry. Finally, the backbone of any strong partnership is trust, and our foundational element of building and maintaining trust is transparency. As co-regulators, it's imperative to us that we're able to share a two-way stream of information. All parties involved need to have access to data to make sure we are in alignment and can use all of our tools to address the issues at hand. As I mentioned earlier, we hope this two-way street of information sharing can be the power that drives the paradigm shift in our inspectional approach. To this end, we will continue to push for an expansion of our information sharing and mutual reliance capabilities, and we know you will advocate for it as well. I want to close today by going back to public health facts. In the US, foodborne pathogen contamination continues to be a significant concern. There are a little less than 10 million cases of foodborne illness each year, resulting in over 50,000 hospitalizations. Conferences like this one and the partnership they represent promise to improve our efforts to bring down the number of foodborne illnesses. And as we move towards an even more integrated food safety system, leveraging the strengths of our partnership as co-regulators and utilizing more data and information, we anticipate opportunities to become more effective and efficient in a new paradigm. In the future, we can offer findings from our data and analytics so we can inform state partners about insightful connections and emerging trends that will enhance our collective oversight, including how we allocate our regulatory resources. Our work then will be based on leading indicators that will allow us to be proactive, no longer just reactive. We strongly believe that sharing data and information between the states and FDA, as well as with industry, can lead to a more data-driven surveillance of our nation's food. I want to thank you all again for your dedication to public health. I want to thank the AFDO community. I'm very excited for your future work together, and I look forward to our continued discussions and collaboration. Thank you.
Well, thank you very much, Kyle. We appreciate your remarks. We'll now move on over to Dr. Miller.
Thank you, Steve, and hello, everybody. I want to thank our partners at AFDO for inviting me to participate today, particularly considering I'm recently serving in this new role. It is my distinct pleasure and honor to be here as the Acting Associate Commissioner of the Office of Inspections and Investigations, or OII, and I am really thrilled to be leading this organization and began this role last month when my colleague, Michael Rogers, retired after an incredible 34 years of service. As you know, OII is the front lines of defense for public health, and like your investigators and inspectors, we are the people on the front ensuring that food, drugs, and other FDA-regulated products are safe for American consumers. And like your own inspectorates, we find ourselves with an extraordinary inventory that we oversee and regulate. And you may or may not be surprised to hear that every 33 minutes of the day, our investigators initiate an inspection or regulatory action. This work helps get and keep harmful products off the shelves. It brings life-saving products to market and holds bad actors accountable for threats to the public we serve. Being at the helm of OII has been challenging, but also highly rewarding. I've been able to leverage my previous experience as OII's Medical Products Inspectorate Director and as an executive at the United States Pharmacopoeia, among other roles. And it is this wearing of several hats throughout my career that has given me an interesting perspective that helps me connect with a wide range of partners and more fully understand the impact of the work we do. FDA depends on partners and stakeholders to help us innovate and stay abreast of changes. Without our regulatory association and industry colleagues like yourselves, we cannot fully achieve our mission to protect and advance the public health. As I join you today, I'm often reminded of how partnerships help us meet our shared mission. For example, in 2023 and 4, FDA conducted an investigation into applesauce pouches with elevated levels of lead. This investigation ended in a national recall of the foreign and an inspection of a foreign supplier. And we eventually confirmed the supplier was providing adulterated cinnamon to the manufacturer. It's also critical to note that this was triggered following information from a state laboratory sample collected during an investigation into reports of children with elevated blood levels from our state partners. In turn, when this implicated product was repeatedly observed at retail despite the recall, it was our state partners and FDA working together that we conducted retail audit effectiveness checks to ensure that the recall was effectively completed. In another example, just a couple of months ago, teamwork with our partners again helped us ensure that a recall was effectuated and the public was protected after recalled teething sticks that pose a choking hazard for babies were observed at retail. These are just two examples of how critical partnerships are to our assuming consumers and patients are safe. Everyone has finite resources, and we need to collaborate to ensure we deploy those essential resources in the most effective and impactful manner. We have a shared mission, and AFDO and its members continue to be key collaborators with FDA. AFDO's longstanding partnership with us is crucial to advancing the vision of an integrated food safety system. Your expertise in planning and coordinating technical training helps ensure our state and federal inspectors and investigators, along with other partners, are equipped with the tools and knowledge to meet today's evolving challenges. Through our cooperative agreement with AFDO, OII is contributing towards a stronger, more integrated food safety system. Together, we've supported development and delivery of high-quality training courses that reach over 30,000 human and animal food safety professionals in more than 2,500 jurisdictions. Together, initiatives like these are all examples of the truly amazing things we can accomplish by working together towards our common goals. And as many of you know well, this is a critical time for the FDA. To start with, last fall, as Kyle mentioned, we underwent a reorganization that enables us to realize the vision of the FDA Food Safety Modernization Act. It elevates the importance of nutrition to reduce diet-related diseases and strengthens partnerships. Our reorg kicked off a new chapter for an agency that's been on the front lines of protecting public health for decades. We're working to become even more visible as a world-class inspectorate while modernizing multiple aspects of what we do to drive innovation and ultimately foster trust in the food industry. As part of the reorg, we refreshed our vision and mission. And our vision is that OII's global inspections and investigations ensure FDA-regulated products are safe, trusted, and accessible. Our mission is to conduct rigorous, transparent, and science-based inspections and investigations while providing real-time evidence and insights that are essential to empower fact-based regulatory decisions to protect public health. This vision and mission build on our legacy of our success while articulating ways we'll grow as an organization, like moving towards enhanced real-time insights. I'd also like to highlight a few additional changes from the reorg you should be aware of. Our compliance functions that were previously managed by ORA are now in the food product centers. And this unified compliance effort is designed to streamline compliance functions and improve our enforcement capabilities. Following the reorganization, our recall coordinators have the same responsibilities and remain positioned within our field offices. While we have multiple human food recall coordinators across the inspectorate, animal food is unique in that it has one recall coordinator for the office. The reorg also streamlined our consumer complaint handling to be more efficient and responsive to public health concerns. With this new process, our human foods programs and centers handle the intake and the triage of inquiries, and then collaborate with OII on follow-up activities. OII, in turn, coordinates follow-up when appropriate with our state partners, who often conduct complaint follow-up on behalf of the agency as part of their own inspections. And this cooperation has been instrumental in national recalls. And of course, the last months have seen further changes to improve efficiency in operations. I can tell you with full confidence that we are ensuring medical foods, medical products, and foods are safe, effective, and accessible for Americans and their family, and this is our top priority. I will also note that we've been operating under paradigms that are frequently part of a change of administration and as well as new priorities that are emerging. And we recognize that this has impacted our collaboration. For example, I know our current travel restrictions have impacted contract audits that help your programs conform to regulatory program standards, and we're working on an exception to the restriction affecting these audits. I want to thank the states that have worked with our divisions to find creative solutions to accomplish some audits, like state inspectors and auditors traveling to where the FDA investigator was located, or the state inspector picking up our investigator to conduct the audit. Our divisions will work with you to make a plan to meet all of your audit requirements. Regarding the upcoming fiscal year and contracts, we strongly encourage and will support states moving into phase 2 and 3 of the contract audit program. And FDA will prioritize training and verification audits. This would also help your program maintain conformance with the program standards. I would also like to highlight a project we believe that will enhance our collaborative efforts and streamline our processes. We are really excited to collaborate with AFDO on templates that several states developed to promote consistency in state contract inspection report writing. We shared with AFDO a summary of findings template that we think will reduce the administrative burden of report writing, which I believe was shared at last meeting. The template for state report parallels changes we're making for our own investigators, and we look forward to piloting with the states. Our collaboration will bring this to fruition, and your insights and feedbacks are crucial as we continue to work together. So a lot going on. Time and again, we've risen to the challenge and strive to be better, and I know we will continue to partner to ensure we serve the public in the most effective and efficient way possible. Embracing our constant state of change has never been more important than it is today, as the products we regulate and the needs of the public evolve more quickly than ever. And as our Commissioner, Dr. McCary, has said, a well-trained inspectorate is vital to ensure the safety of our nation's food supply, especially with emerging public health concerns and the need for new approaches to food safety. We need a high-performing and adaptable workforce. To that end, we will expand hiring, we will improve our technical skills, and reduce competency gaps. We also want to enhance the effectiveness of data sharing, as Kyle spoke to ensure that violations are evaluated and corrected quickly. And with our focus on inspections and investigations at OII, we are positioned for that excellence, but we can't achieve it without our state partners. As Kyle also noted, the President budget for FY26 includes $33 million for the expansion of current state contract agreements for routine inspection of domestic food facilities, and we look forward to working with our state partners and the Human Food Program to advance this. Maintaining a qualified inspectorate is a priority for us, and all of you know we have faced challenges with the loss of some of our staff. And this is not new for the federal government, and more specifically for our food inspectorate. Our staffing levels have fluctuated over the years, and I know our state partners face similar hiring and retention challenges for highly qualified staff. We're exploring different ways to expand our operational staff. You may have seen the most recent investigator announcement that was specific to the food inspectorate program. Despite the hiring freeze, we were able to get a public safety exception. And as we continue to optimize around the globe, advancing technology will play a greater role in keeping people safe and building public trust. We continue to embrace food and agricultural technologies to better regulate the food supply, and we're committing to growing 21st century screening and data tools. In fact, just a few weeks ago, the FDA launched our new AI tool, ELSA, which is already expediting clinical protocol reviews and reducing the time to complete scientific reviews. Finally, we always welcome feedback from you on how we can do things better. We are open to stakeholder transparency and want to keep open our lines of communication. So thanks again for having me today. I'm sure the 129th AFDO Annual Educational Conference in Dallas next week will be another huge success. And I look forward to your questions in a little bit. And now I will turn it over to Dr. Eblen with USDA.
I have some slides to share, just bear with me.
While we bring up the slides, I do want to thank Dr. Miller and, of course, welcome Dr. Eblen, our next speaker. And it's always fun when you're doing this in front of a group.
Doing it live. Hold on. I'm almost there.
All good. Believe me, most of us have done this, and that is always a little bit of pressure, I will say. I also want to remind anyone, if you have questions for the panel, please go ahead and put it in the Q&A box. We will be monitoring that as we move through the next presentations after those presentations, moving into the QA session.
Okay, can you all see this?
We can see it.
Excellent. All right. Well, thank you all for the invitation to be here today. I think it's very important to come to engagements like this. It's really a great opportunity for us to meet with our stakeholders, myself, my colleagues who just spoke, and Megan coming up. And I really appreciate the chance to talk to you about FSIS, about our public health mission, and how we inspect and regulate. So thank you again, AFDO, for the invitation to come here today. So just to start out and level set, our mission at FSIS is to protect public health by preventing illness from meat, poultry, and egg products. So, of course, while we have these products under our jurisdiction, FDA has everything else, and we're quite so we really focus meat, poultry, and egg products, but we do collaborate with FDA routinely. And our vision is that everyone's food is safe, and I think everybody on this call can share that vision. I've been administrator here at FSIS just for about 6-7 months now, and but I've been with the agency most of my USDA career, and I strive to make sure that FSIS remains a data-driven agency and that we lead with science. It's very important to me that everything that our inspectors do, our frontline inspectors, and everyone else in the agency really is based on science, so that we are regulating as much as we need to and no more, so that everything is really based on scientific. We can bring everything back to science principles. To advance food safety while continuing to conduct inspection at all federally inspected meat, poultry, and egg product establishments. So of our agency of about 8,500, somewhat less now after the DRP, over 80% of our folks are frontline inspectors, with other folks working in labs, investigations, and various headquarters functions. So let me talk a little bit about our priorities. So just a second. Sorry. Oh, I'm sorry. I'm just trying to, I want to make sure I don't forget anything. So our priorities. Our priorities include, of course, ensuring that our food safety practices are based on the best available science and technology. That's something I've already talked about. Also, we're constantly taking action to strengthen our inspection and oversight. And especially in the last several months with DOGE coming in and the new administration, we really have been examining all our policies and practices, how we do inspection, the oversight we conduct, to make sure, again, that everything we're doing truly is science-based and does make a difference in terms of public health. Another priority, of course, is to prevent foodborne illness attributable to all our federally regulated products. It's very important to us that the food that goes out the door is not just abundant, but also safe. We verify that labeling is truthful and not misleading. We prioritize, like I'm doing today, effective collaboration and communication with public health partners, consumers, and stakeholders. I think it's very important that we be as transparent as we can possibly be to share what we're doing, what we're thinking about, what we've done and results we may have got from that. I want to make sure that we are being as open as possible to have this continued open dialogue, so that we don't do anything that's surprising to folks. We don't do anything that's uninformed by stakeholder input. So really, it can be summed up as saying we're using a data-driven approach to optimize our inspection and outreach strategies, our sampling programs, the data analysis we do, the data we share, and IT systems, trying to make sure we're as up to date and as responsive and reactive as we can possibly be. And going forward, the priorities of the current administration, as well as newly appointed USDA leadership, we have an Undersecretary for Food Safety has been nominated. We'll be taking into account any and all feedback from them as well. But everything I've described is certainly within scope of what USDA supports at the moment, of course. Sort of mentioned this already. We have 8,500 employees, at least we did until the DRP. Now we're about 8,100. The vast majority of this is still over like 83% are frontline, and we have 7,100 federally inspected establishments. So this is obviously this is a lot, and we want to make sure that everybody is properly resourced, properly trained, And we're lucky that since the start of the administration, even though there was this widespread hiring freeze, we got an exception for public safety so that we could continue to hire frontline staff. Secretary Rawlins was very supportive of that from the start. So next I want to discuss Secretary Rawlins' announcement to increase funding and reimbursements to states for meat and poultry inspection programs. So in May, Secretary Rawlins announced she'll exercise our funding authority to provide a funding increase of $14.5 million to reimburse the states for meat and poultry products. There's currently 29 states operating MPI or meat and poultry inspection programs. As each state program varies in terms of scope and cost and fiscal year schedule, we work through an ongoing process to maximize reimbursement levels for each state. And while the reimbursement rate for MPI programs had declined in recent years due to budgetary constraints, the additional $14.54 million announced by Secretary Rawlins will allow FSIS to return to an average level of 50% reimbursement to the states, as authorized by the Federal Meat Inspection Act and the Poultry Products Inspection Act. And without this funding, we fear that states would not have the resources to continue their own inspection programs, which ensure that meat and poultry products are safe. And so the funding increase ensures American-produced meat and poultry can make it to the market and onto the tables of families across the country, to restaurants, to institutions, and so on. Switching gears a little bit, I'd like to talk about several operational measures the agency has implemented based on our review of the recent foodborne illness outbreaks and large-scale recalls of ready-to-eat meat and poultry products linked to listeria. The measures we put in place are aimed at strengthening the agency's oversight of the food processing facilities we inspect and ensuring safe and abundant food, including we've added broader listeria species testing to all samples of ready-to-eat products, environmental and not just products, but also the environmental and food contact surface collected for analysis by FSIS. We've updated instructions and training to better equip FSIS inspection personnel to recognize and highlight systemic problems at FSIS inspected facilities in a standardized way. We have a RTE questionnaire that verifies specific listeria-related risk factors in plants weekly. And we've been gathering that data and the listeria species data since January. Also, we've been prioritizing food safety assessments, and these are in-depth, in-person reviews at ready-to-eat meat and poultry plants. And these assessments are often accompanied by targeted listeria sampling. And we believe that adding the additional listeria species testing to the agency's sampling will help provide more information about the effectiveness of a facility's sanitation plan and can signal to us if follow-up is needed, for example, a food safety assessment or intensified sampling or other enforcement actions. Let's see. So that's what we're doing with listeria. And we continue to have this as a huge focus, of course, given the challenges that we faced last year with listeria. Food safety assessments. So we have conducted, we're over 500 now as of June 17th. I think we're at 510 FSAs. And we typically do FSAs at RTE producing establishments that have not had an FSA in the previous 3 years. And these reviews provide information about each establishment individually and collectively, and could inform future actions to target this pathogen. And follow-up visits by FSI's field supervisors bolsters insight from more senior inspection staff, just to check, or just another pair of eyes to ensure that the establishment fully addresses issues identified during an FSA and could inform enforcement action by FSIS. And then intensive verification testing is our term for going in and doing listeria testing. We typically do product testing on a scheduled basis, but we will do the IVT or intensive verification testing along with food safety assessment if warranted. And typically with listeria-based food safety assessments, we would do one. Withdrawal of the Salmonella framework. So This was a focus of the last administration, but we announced on April 24th this year that we were withdrawing our proposed rule and determination to title Salmonella Framework for Raw Poultry Products. So we initially posted this August 7th, 2024. However, when we, and it was open for comment through January 17th, but we determined once we looked at those comments, we had over 7,000 comments with over 1,000 original comments. There was a lot of write-ins as well. We really determined that we had to have additional consideration in light of the feedback we got. There was a lot of really good and thoughtful feedback, and we figured we need to really look at that and reconsider our approach. And again, we have a new undersecretary coming in, so we want to make sure we're really informed by the priorities of the new administration. Everyone's priority is that food is safe, but there are different ways to approach it. And we reckon that there was enough concern raised in the comments for the framework that we would withdraw it and consider further. So we can continue to prioritize public health, committed to further assessing our approach for addressing salmonella in poultry products. So right now we're determining whether we should update the current poultry performance standards. Right now our performance standards are based on presence or absence of salmonella, and we may move to another way to determine performance standards based on enumeration, serotype, or some other factor. So all that remains to be determined. But safe to say we are continuing our focus on salmonella control. Poultry line speeds and swine line speeds. So on March 17th, Secretary Rawlins directed us at FSIS to extend line speed waivers previously granted to certain young chicken and swine slaughter establishments. And the extension allows these establishments to maintain higher line speeds while we conduct rulemaking proposing to codify these changes. This is a top priority for the Secretary, and rulemaking to formalize these line speed increases is underway. I want to clarify that the extension is limited to young chicken and swine establishments currently operating under line speed waivers, and that we won't be issuing new line speed waivers. And I also want to emphasize that various analyses we've done show that there is no significant difference in food safety compared to the line when you look just at the line speeds. And there is a high bar that establishments need to meet to maintain their waiver to have higher line speeds. More details on the clarification about the line speeds can be found in the April 4th, 2025 FSIS constituent update. And please stay tuned for more information on this rulemaking in the near future. Consumer labeling research. So we recently issued on May 23rd, Consumer Labeling Research Final Report, and this outlines results from a recent study designed to test consumer responses to potential revisions to our safe handling instructions label that appears on all meat and poultry products. So we contracted with RTI International to conduct the study, and the study involved a literature review, many listening sessions with consumers, industry, and other relevant stakeholder groups. We had focus groups, in-depth interviews, and a web-based experimental survey. And several alternative labels were designed by a renowned graphic design expert, and consumer responses were assessed. The study aims to add to an extensive body of research already commissioned by FSIS on the safe handling instructions label. This is the second big study, should I say, that we've done on these labels. And the previous SHI study, as well as the recent one, and other consumer research studies are available on our website. And so we look forward to briefing incoming leadership on this body of work, looking at options for next steps. It's a very comprehensive report, a lot of food for thought, so I encourage you to have a look at that. So I think that's everything I had. Before we move on to the next speaker, I just want to share some ways to stay up to date on FSIS news. Our website, of course, is the best place to find agency communications and resources. We have a weekly newsletter, as I mentioned, the constituent update, which is emailed every Friday and covers recent updates. We have monthly establishment town halls and stakeholder meetings that you're invited to attend. And you can contact us anytime at fsis@usda.gov. So that's all I have for the moment. I look forward to discussions soon, and I will stop sharing.
Thank you very much, Denise. Moving on to Dr. Nichols.
Good afternoon, everyone. And I just wanted to start with a thank you. Thank you so much to our partners at AFDO for this opportunity to brief everyone. I know I'm a new face amongst some in this group. Our division director of over 30 years, who worked at CDC, Dr. Rob Tokes, retired in June of 2024. And as of December, I've taken on the mantle of the division director for our division of Foodborne, Waterborne, and Environmental diseases. And I wanted to also thank all of you who work day to day in the field or in your respective roles to help with this network of food safety. Truly, without you, we would not be able to accomplish our mission. So as many of you know, CDC really conducts the disease surveillance with our partners across the United States to put together the puzzle and form a more complete picture of foodborne illness. Whether it's outbreak response or prevention measures, this is something that helps us to protect food safety and food security. CDC is a public health entity, which is non-regulatory in many cases, which allows us to provide a vital link between the detection of foodborne illness and the food safety systems of our government and food producers by monitoring and investigating outbreaks alongside many of you, our state, local, tribal, and territorial public health and food safety agencies. To mitigate these outbreaks, our work relies heavily on you. So our CDC groups collaborate and coordinate with state epidemiologists, public health laboratory scientists, and other officials who work to investigate and report anything that they're picking up in the field. And this helps us not only with our long-standing issues, such as Salmonella, E. coli, and Listeria, but also with emerging issues that could affect food safety that we haven't encountered before. And I know that many of you have worked on things like Chronobacter and what are the impacts of that, and on some of the potential concerns around H5 illnesses and food safety. So we're grateful for that. So how does CDC do this? Well, in addition to many of the calls and meetings that you were all on with us, we do provide $22 million, and that was the last fiscal year, through the Epidemiology and Laboratory Capacity Cooperative Agreement. This is direct funding related to food safety, including surveillance and outbreak response. And this funding goes across 56 different jurisdictions. When we look at the numbers, this funding supports all or part of nearly 400 epidemiology and laboratory staff in state, tribal, local, and territorial health departments. ELC also supports some of the critical contracts and contract staff that are related to food safety in these jurisdictions. And although we collaborate with many partners to investigate the early signals, or what we call clusters of foodborne and other enteric illnesses in the United States, our approach to responding to multi-state foodborne outbreaks is very unique, and we continue to update a lot of our findings related to those on our web pages and would encourage you to look there for more information. I wanted to bring up some potential themes that I am encountering in my day-to-day. And I'd say overall, the umbrella of this is probably change. And that is looking at our food safety surveillance activities. We know that these activities provide a critical early warning system to detect dangers in the food supply. And one of the great changes that we've seen is that we are able to detect these outbreaks earlier and when they're smaller, and work with our partners from USDA and FDA to take protective measures in order to reduce the size, scope, and severity of these outbreaks. This is absolutely critical. And the change that we're seeing here is a need to really modernize and look at many of these opportunities. So not only are we able to use many of the existing technologies, especially in our laboratories, to do detection, but as we move towards more diagnostic tests that are bedside in hospitals that may not generate an isolate or a bacterial culture, that we are using the laboratory technologies and adapting our methods to still be able to pick up those outbreaks in a world that doesn't have any cultures, or a culture independent diagnostic test world. This is something that's really, really important, especially to our PulseNet laboratory, which is a little bit around our second theme. This is a laboratory network that is supported by CDC, consisting of 83 public health and food regulatory laboratories. PulseNet gathers the information into a national database to identify bacteria that are making people sick. And we find that this investment is really important because for every $1 invested in PulseNet, $70 are saved. And PulseNet is also a very flexible system as we are able to incorporate other items into our national database. I mentioned Chronobacter earlier on, and as Chronobacter became nationally notifiable last year, one of the things we are working to do is incorporate Chronobacter into the national database of PulseNet. PulseNet is the most effective because it relies on the network, again, the collaboration to do this detection in relatively real time. And we're continually working to improve and modernize not only the laboratory methods, but also the data platforms we use. So AI has been mentioned, and we're, of course, continuing to innovate and look at ways that we can utilize AI in these platforms that exist in order to better detect some of the nuances that we might need in the data. For example, looking across receipts and identifying common foods that may have been eaten by those who became sick. The next piece I wanted to talk about is some of our efforts around FoodNet. So although foodborne outbreaks often get most of the attention because they generate headlines, they can be very severe, they are often fast moving, we are not able to do that investigation of outbreaks without understanding the baseline of what foodborne disease looks like in the United States. And part of the systems that are very, very important to that include things like FoodNet. FoodNet is an active surveillance system that engages with 10 state health departments and academic partners to collect data on priority enteric pathogens, and it's considered one of the gold standards for collecting data. It allows us to develop some of the foodborne burden estimates and attribute the burden and diseases to specific food items. It also allows us to determine if some of our public health interventions aimed at preventing specific types of foodborne illness are effective. And it allows us to track trends over time and really look at what we might see that is changing with respect to the foodborne landscape, and to share that with our partners so that you can be on alert for any new emerging or other items that you might see while out in the field or in your communities. This also allows us to continue much of our work on antimicrobial resistance threats, which is also very critical, as we know that that is something that continues to impact patients with foodborne disease. So ultimately, I know that you've heard from many of our panelists, but I do want to emphasize the importance of this type of collaboration. I think one of the great things is that we have the opportunity to work across USDA, FDA, and CDC on a daily and ongoing basis, sometimes multiple times a day, in order to really bring together this full picture of what national food safety requires from us at this time, and to adapt to a lot of the changes and emerging diseases or emerging trends that we see. So with that, again, thank you to AFDO, thank you to all of our partners, and look forward to hearing your questions. Thank you.
Well, thank you very much, Megan. Well, thank you to all of our presenters. We'll go ahead and begin with some Q&A. Once again, if you have a question, please go ahead and put it in the Q&A window, and we will be getting to those in just a moment. We're going to start with a kind of a generic question for everyone on the panel. And historically, training and retention at both the state and federal levels have been an ongoing challenge. I think everyone on this call shares that as a concern and would like to hear a little bit more of the efforts you're leading to recruit, train, and retain the food safety staff of the future. Maybe we go ahead and start with Kyle, and then kind of go in the order of presentation for this one, if that makes sense.
Yeah, thanks, Steve. Really appreciate it. Look, with limited budgets historically and continuing today, we do have to think of new and innovative ways to attract, retain, and grow a qualified workforce. And look, I'll be the first to acknowledge that the best ideas, whether it's policy, regulatory, or otherwise, are often coming from the folks on the ground, right? Our key personnel in the field, doing the review work in the facilities, directly engaging with industry. These are our critical employees, and it really is critical that we acknowledge the importance of their work and their retention. And, there's no doubt we've had a series of departures, retirements, and attrition at FDA and really more broadly. We're in a little bit of a unique spot in the human foods program, given that we did go through a large scale reorganization in October of last year. That reorganization unified FDA's previously fractured food work and portfolios and created the human foods program, but standing up the program did leave a number of gaps and unfilled positions. And of course, on top of this year's departures and attrition, we do have some gaps there that we are working to catch up on and fill those positions as much as possible. I am proud to say we have made strides in ensuring our review work, our labs, our inspectors, and our compliance teams have had very limited impact to date and are running full speed ahead. And we're also pleased to be on a path to start filling some critical review hires, having just released a series of job announcements less than 10 days ago. And we're confident that those will help us backfill, those who have retired or moved on to other opportunities. And specifically, we're prioritizing filling critical roles among our food inspectorate, as I'm sure Elizabeth will reference, as well as our inspectorate adjacent roles and reviewers to help support our post-market chem safety initiatives. So we are hoping to post even more announcements in the very near future. So we're really excited about the future on training, hiring, and retaining key staff. But look, speaking more broadly, there's no doubt training and retention is, of course, key to maintaining a qualified workforce, Steve, as you mentioned. And strong qualifications for individuals involved in food safety oversight is a requirement, right? Regardless of if it's for state or federal activities. And working together to leverage joint opportunities should not just be a best practice, but really a standard there. And I would just add from a federal food safety agency perspective, when we talk about hiring and retention, we do have to recognize that robbing Peter to pay Paul never really works in the long run, right? So finding ways to support each other in a competitive hiring market, it's critical. And that's where training, on-the-job learning opportunities, and sort of growth potential are directly aligned with retention. So jointly working to help individuals see that value and the impact of working in food safety at all levels, I think, is something we all need to continue to collectively champion.
Okay, Dr. Miller.
Thanks, Steve, and thanks for the question. And, I will say retention of staff, and I know our AFDO partners also probably experience the same thing. It's always been a challenge for operational staff due to the nature of the work. And our hiring efforts, have ebbed and flowed with trying to keep up with that attrition rates. And despite these challenges, I think our foods program inspectorate has kept pace in conducting inspections last year at a rate that's consistent with past years. And, happily, as Kyle mentioned, in the midst of this hiring freeze last week, we were able to use an exception targeting investigator hiring. We posted 2 job announcements targeting investigators for the foods as well as the medical products inspectorate. And I think this really shows the administration and our leadership's commitment to field operations and public health. We're using Title 21 hiring authority to do this, which is a direct hire authority. And it became available to the Foods Inspectorate in early June of 2023. We're really looking forward to, reinstituting retention incentives for our inspectorate. I've had many conversations with leadership on how we might look at different opportunities to really incentivize this. And, recognizing the job is challenging, the people that sign up for this job are very passionate about what they do. And even though they operate in challenging environments and have to travel frequently, and, our colleagues that are reviewer may be able to do the work from behind a computer desk, we still want to ensure, that we have a competent, confident workforce. And speaking to training, this is an area of passion for mine. From my previous role, really looking at the medical products inspectorate, which are much smaller inspectorates that, didn't have the same surge capacity. We really have to look at how we continue to train people to keep up with the different technologies, but also the basic training. And I have 3 adult children, and I can tell you, taking 18 months to become fully competent in doing work is going to get a 0 return on investment. So we really have to revolutionize the way we're training our inspectorate. So I have a lot of ideas about how we might do that. As more information becomes available, I'm going to, talk more about these concepts, but really looking to cut that training time in half so that, you know, our next generation of investigators can become productive much more quickly. And, you know, I think that will be better for everyone. So really excited to, at the right time, work with our state partners on ensuring we're all working to get our folks competent and confident much more quickly. You're on mute.
All right. It helps if I unmute. Dr. Eblen, you're up next.
Yeah. So as I think about training and recruitment, we're constantly recruiting. As I said, we can, our positions, our frontline positions were designated public safety, and so we were able to continue hiring. But even before last administration, the administration before that, we're constantly advertising, constantly hiring, constantly training our frontline folks. When people come on first as inspectors, they do inspection methods training, which is a pretty intensive multiple-week training that they do. Of course, they do on-the-job training. And then refresher training in various topics as well is always available. And so, and then the same with our folks in the labs, we're always recruiting there, and then with our investigators. So those are our three frontline. Yeah, and we've been able to continue to hire. We're in every plant every day, all over the country. So sometimes it can be tricky to get people in some of these more out of the way places. We have patrol assignments. And so I guess I would say it's a real priority for us. We have to make sure that everybody gets inspection every day. And so, and of course they want somebody there who's trained. And so we put a lot of investment into recruitment and training. And we're very fortunate that we've been able to keep that going over the past several months as well. So that's what I guess I would say about recruitment and training at FSIS. Megan?
Yes, I'd agree. I think one of the things that is very evident to me is having a robust ability to recognize the continuum of this cycle and really a pipeline to bring in new innovative ideas from early career professionals. And I recognize that that perspective has been so incredibly refreshing and valuable to us, and ensure that we have the mentorship available from those who have been in their roles quite some time, who understand how the working relationships can oftentimes make or break an investigation. So that is something that we're very cognizant of. And not only are we really instilling those values at CDC, but also continuing to make sure that there is funding available and prioritizing that funding for our state, local, tribal, and territorial partners so that they can onboard and bring those perspectives. And then having routine forums where we engage and train together on these methods, where it is laboratory-based training or whether it is epidemiologic-based training, and oftentimes learning these new tools. And I will say, I think that has been one of the most rewarding parts of this job so far, are those opportunities to engage and really learn from each other. So I think I would echo what my colleagues are saying in terms of really the importance of ensuring that we have the ongoing capacity to bring in folks, and the need to continue this cycle of training to really take advantage of opportunities in the food safety space.
I will also note that our panelists are responding in the Q&A window to some of the questions, so definitely take a look at that window if you haven't. There's one question that Deputy Commissioner Diamantas has already responded to, but I want to address that also over to both CDC and FSIS. And the question is, will we be able to reach the goal of reducing foodborne illness as stated in Healthy People 2030, particularly Shiga toxin producing E. coli and Campylobacter? I'll start with Megan on this and then go to Denise, if that's okay. Oh, I see you might have responded already.
No, this gives me a chance to elaborate on some of these activities. So I view our Healthy People 2030 goals oftentimes as things that we are articulating as kind of a unified understanding of a place that we want to get to. And doing this on 10-year increments oftentimes also is a challenge in addition to an opportunity, not knowing how that landscape and some of our priorities or activities may need to shift and adapt. 10 years ago, we were still using pulsed gel electrophoresis to detect some of these outbreaks. And today, our whole genome sequencing is on board, and we're looking towards the future of metagenomics. So I will say, I think there's a tremendous opportunity here to continue to make progress towards those goals, to look at what levers we can pull, not only in the education, the behavior modification, the regulatory, and the kind of collective space with our industry partners to really move the needle on this, but also to continue to measure and ensure that we have the tools to look at over time how much progress we're making. And so that's something that CDC, especially with FoodNet, is absolutely committing to do. And I put that link in the chat. Thank you.
Great. Denise.
I mean, I would echo the sentiments of Kyle and Megan. We are, we gather this information. We collect samples all the time. We collect about 90,000 samples a year. We do whole genome sequencing on all the pathogens, and it really does allow us to do that identification of clusters. Of course, we do illness clusters. We identify, like CDC identifies that, but also we can identify as clusters that we're finding in food. We can go back, the inspectors can have this information and go back and see what's happening. And we really believe that this is the advent of whole genome sequencing has really given us that new tool to be able to pinpoint better the establishments where there are challenges and issues. So we really hope that that'll help us continue to drive down the prevalence of these pathogens in inspected foods and ultimately get us closer to that goal, those healthy people goals.
Dr. Eblen, I think I'm going to go to you next. And the question really, and I know this is an area of passion for you, having worked with you on this area for many years. So talking a little bit about salmonella in poultry, you talked a little bit about the rule that was rulemaking that was rescinded earlier. But the overall question that someone is asking in the chat is, why is salmonella treated differently and not an adulterant in poultry as E. coli 0157 is in ground beef? Why is that a different treatment, if that makes sense?
Yeah, good question. So I will start by saying that there is a circumstance in which salmonella is an adulterant in raw product, and that's if it's associated with an outbreak. And so if it's associated with an outbreak in raw product, yes, it's an adulterant, and we can, we can follow up on that. But in general terms, when we find salmonella as part of our routine testing, as part of those 90,000 samples, unless it's in ready-to-eat product as well, where it's an adulterant, we don't regard it, it's not adulterant. That product can continue to be sold. And that's something we investigated as we looked at the salmonella framework. We investigated a very narrow set of circumstances where salmonella would be regarded as an adulterant. And also in the not ready to eat breaded stuffed chicken determination, if salmonella is there at 1 CFU per gram or more, that product would be adulterated. With the framework, and the framework was rescinded, the stuffed chicken is not yet enacted. We've delayed that until November. We just it's so prevalent. Salmonella, it's not that it's so prevalent, but what is prevalent is Salmonella Kentucky, for example. More than half of our samples that we serotype out are Salmonella Kentucky. Those are very, very rarely, if ever, associated with human illness. Also, we found very low levels of salmonella. When we did prevalence, you find a certain amount, but when we looked at the levels there, they were extremely low. And these couple of things, in addition to other comments that we got with the framework, really give us pause to think, wait a minute, does it make sense to make salmonella an adulterant with a broad brush when there are certain circumstances where some salmonella are less pathogenic than others? Not that any salmonella is good, but we want to focus on the ones that are truly making people sick. And so that's what we are looking at now. As we look at our performance standards, right now they're prevalence, presence, absence. We want to make sure that we if we introduce something new, that it really is focused on those salmonella that are making people sick. And so that's what we are actively working on at the moment, is new alternatives for performance standards. When we have an undersecretary, we want to be able to present her with some options for performance standards so that she can assess those and move on as she wishes. So for right now, we really think that applying a broad brush to say salmonella as an adulterant is too broad. We want to be more targeted. And so that's where we are at the moment.
Okay. Kyle or Elizabeth, would you like to add anything on the Healthy People 2030 piece or any of those topics before we move to the next question? I'm not seeing anyone volunteering, so I'm going to go ahead and move to the next question. The next question I have on the list is: there's been a lot of change in the last 18 months in all of your agencies. Standing up the new Human Foods program, a lot of significant retirements were mentioned, and the administration transition. With all of these changes comes opportunity. What do you see as some of the opportunities going forward that this change enables? And I'll start with Kyle on that one.
Yeah, thanks, Steve. Really appreciate it. Look, I think with the creation of the Human Foods Program, we have a lot of new opportunities to sort of redefine what our path forward is in our regulation of food. And I want to talk a little bit about the paradigm shift of creating a truly integrated food safety system where states handle routine domestic inspections that'll help strengthen the overall collective food safety system. And this is something that everybody's heard about, seen about in the potential budget and potential directive from Congress to shift routine domestic inspections to the states. And look, this will be a multi-year process. We're not switching off the lights here at FDA and asking states to do all of this tomorrow. Far from it. We need to get it right from a funding model perspective. We need to understand what the inventory is. We need to make sure we can leverage technology and have seamless data sharing as a foundation for success in this pathway. And look, we want a system that's flexible but unified and complementary so that we can work hand in hand with our state co-regulators on the issue. And we're looking at lessons learned over the past decade as we see what the path forward is for us in this new integrated food safety system. Produce has been a good model for us. They already do 90% of our inspection work, and there's certainly some learnings from our produce work that we're able to leverage. But the framework itself that we envision is a new inspection model that relies on states to conduct those routine domestic inspections through a sort of a tiered risk-based inspection model that would strategically leverage the capabilities of both FDA and our state partners. So the transformative element of this, Steve, as I see it, is the creation of a new, or maybe the redefining of a new level 1 routine inspection. And FSMA, as you all know, does not prescribe a definition for what a routine inspection is. And that offers us an opportunity to really decouple the concept of routine from the current more intensive framework, and instead create a more simplified, scalable entry point for regulatory engagement through a level 1 routine inspection framework that we've been working really closely with our colleagues in OAI on developing. And while we're at the really early stages of this, we do envision there to be a rollout of a plan that sort of acknowledges the diversity in regulatory approaches by establishing defined inspection tiers, aligned with risks, complexity, and regulatory needs of individual facilities. As we consider sort of what meets this threshold for being a routine inspection, we envision for now that things like infant formula, juice HACCP, well-classified canned foods, potentially dietary supplements sort of will fall outside of that initial framework of being routine, that we would keep that at our level for now. But then as the process develops and states get better at this work, there may be opportunities to transition that work to the states in several years as the program itself rolls out. So, I believe that this is really a transformative time for us in food safety, particularly on the inspection front. And we're really excited about the opportunity to continue to develop this internally with our colleagues at OII and to work with our state partners to roll this out over the next several years.
Maybe Dr. Miller?
Sure. And just echoing what Kyle said, I think this administration recognizes the critical role states play in food safety oversight and, are really working to restore resources to help accomplish our shared mission. And I like the terminology used, opportunity. And I do think, with the reorganization and streamlining compliance, we now have a more specialized inspectorate, and they're able to align more closely with our human foods centers, both the Human Foods Program and the Center for Veterinary Medicine. So really taking a look at where are those opportunities to really do that more risk-informed work, utilizing, some of the new tools that we are getting rapidly, with the administration's commitment to new technologies and using AI to harness large data sets, I think, there's never been a time like there is right now. And, fully recognizing at the end of the day, we all have finite resources and we have to make sure we're deploying those in the most efficient and most productive manner. So I really look forward to working with the Human Foods Program and with our Center for Veterinary Medicine to really ensure that we are deploying our resources in the most effectual way to get the right public health results. So really looking forward to also, working more closely with the states in new and innovative ways so that we can all have the same level of competence in how we are doing, and as well as ensuring we have the right standards by which we're all inspecting against so that, there's regulatory predictability for those that we regulate.
Yeah. Before we move on to the next one, I just want to recognize both the Human Foods Program and OII. I have seen the draft of the new inspection report or collection tool. It is a significant improvement from today. I will say that. And I think our state partners will be very excited as they start looking at that as an option. So that's a huge improvement, and we thank you and your teams for that work, and particularly Lori and Mick. I know they spent a lot of time on that, and Wendy Campbell on the other side. So we really appreciate that work that's been done there. Okay, sorry. Now moving on to Denise.
Okay, looking at opportunities, I mean, a couple of things Elizabeth said there really resonated with me. Risk informed, and finite resources. I've never worked ever in my whole career where resources were not finite, sometimes more finite than others. But certainly with the income of a new administration, and this happens with the incoming of every new administration, they ask you to look at what you're doing, examine the processes. Is this the best way to do things? Do we need to be doing this at all? We're doing all of that now again. And I think that it's always a good exercise to do. We're being asked by DOGE, for example, what's in statute, what's not in statute. If it's not in statute, why are you doing it? And there's a lot of things that you can say, well, we're doing it for these reasons. It's a logical extension of the statute. Or, you're right, we've been doing that for years, and perhaps the time has come to reimagine that program or end that program or whatever it may be. So we want to make sure that we're getting back to basics, that we really are looking at what we do, the inspection we do, making sure that it's focused, as I said, on that it's science-based, that it's risk-informed, and that we are regulating as much as we need to and no more than that. We have about 7,500 inspectors. They are in every slaughter plant and then every processing plant every day. And we want to make sure that what they're doing truly is making a difference for food safety and public health. And being able to re-examine everything we're doing under, being asked to do it again, looking at everything we're doing, I think it's always a good opportunity to do that, to determine, to make sure we're allocating our resources to the best extent possible. We have lost a good few people in headquarters. We lost about 5% of our field force, and that was okay because we were able to reassign and realign people. But we lost about 30% of headquarters, and that included some folks with great institutional knowledge. But on the other hand, it gives the next generation of leaders this chance to step up. People have stepped up hugely and very impressively. And so we're confident we have the brain power that we need to be able to move forward, continue to move forward based on public health. So it's been a period of change, but again, nothing that we haven't experienced, I think, in previous administrations, and we'll continue to do the best job we can.
Denise, before we move on, I'm going to ask you about one piece of your workforce that I know the folks on the phone work with, or on the online work with a lot, and that's your compliance officers in your investigations area. Any real changes to that group or structure? I know they're curious about that group.
No, we continue to make sure that we have folks in all parts of the country there to be available. They have sort of passive work and active work. So passive is more where they're going out looking at different places, sort of doing a sort of a risk ranking to see where they need to go. And then of course there's active. When we have outbreaks, recalls, things like that, they're the ones who are boots on the ground, going out to the grocery stores, going out to restaurants, things like that. So we're hoping to be able to maintain the core staff there that we need. Again, USDA hasn't had its reorg package announced yet. So, but having said that, our frontline positions are public safety positions. We can, I'm pretty certain that we can continue to maintain our frontline personnel to continue to conduct those very important functions.
Excellent. How about CDC, Megan?
Well, I will say that I think you have a panel full of potential early change adopters. Maybe we're kind of skewed towards one side of the normal distribution on that. But I've encouraged our team this season to go through the Stop, Start, Keep exercise with the goal of improving public health impacts and really using our data to see that. So I'll give you some examples, some things that we are stopping, and this is kind of not news to anyone, but we really don't initiate case control investigations in the same way we've done before. We've moved on to either case comparisons or utilizing the POP survey when we're looking at whether or not people who got sick ate certain food more frequently than people that didn't get sick, just in the population. And then we're looking at ways we use technology and other innovative tools to actually decrease the burden. When I started my public health career, I used to do those random digit dialing for case control studies, and I would be there multiple weeks late after hours trying to reach people on landlines. That's no longer feasible, so we're stopping that. Same thing with our laboratory technologies. Where is our role at CDC in terms of developing the new innovative types of tests that we are going to need to detect outbreaks and actually tie outbreaks to products? And how are we collectively ensuring uniformity of the platform so that our systems for testing at USDA, FDA, and in the state health and ag departments oftentimes all talk to each other? And I think that's really, really exciting to share that information. And then how are we collecting data to actually measure the effectiveness of what we're doing? And when I say data, it's not only the case data, but how are we working with our partners so they can help inform us about what to start, stop, and keep, and what they're doing on their side, because we know that those resource constraints often impact them, but may lead to some new opportunities on their side as well. So I think for us, it's been a time of embracing change and embracing some of the potential opportunities while really ensuring that we keep some of the core foundation activities that are going to see us through these periods of change.
While we have you up, Megan, I'm going to ask one other question. A lot of the folks on our team are familiar with EIS officers as a kind of a benchmark or a huge part of the capacity in epidemiology across the country. Any status on that program and whether they're going to see a new crop of EIS officers coming up, or how is that program working now?
Thank you for asking. As a former EIS officer myself, and we also have a plethora of folks who used to be in fellowships of a variety of types across our agency, as well as in our state and local health departments. One thing that we are very excited about is continuing to train with our current classes of EIS officers. And we did have the EIS conference in April, during which we had an opportunity to interview and receive placements of some really wonderful new EIS officers. So we're very hopeful to be able to onboard them in the fall. And in our division, across others, they're going to be working on everything from some of the parasitic diseases, such as cyclospora, which I know many of you are familiar with. Of course, EIS officers are continuing to work on the routine bacterial things that you're used to, as well as some of the viral pathogens between norovirus and others, such as hepatitis, that we encounter. So we are very much looking forward to continuing this training and ensuring that these opportunities to pass along knowledge in investigation and work with our state partners in that capacity continues.
Well, with that, we are nearing the end of our time. So what I'm contemplating is giving each of you maybe a minute or so just to say one last message you'd like to get to our audiences and talk about. Maybe I'll do it in reverse order. Sorry, Megan, you're up first. Hopefully that's okay.
That's always okay. Sometimes if you go first, other folks just get to echo what you said. So maybe I'll try and put something out there to get the reaction of my fellow panelists as well. But I think one of the things that I am really looking forward to is the continued collaboration. And I say continued because, again, I think the way we are all bringing our unique strengths from USDA and their knowledge of meat and poultry inspection, which is so in-depth and oftentimes very critical in terms of how that infrastructure and the culture of agriculture is. Our FDA colleagues, not only on the laboratory, but also the epi side, and I was glad that I saw pet products get mentioned. We work a lot with the Center for Veterinary Medicine as well. I think there is a uniqueness about how they have experts in eggs and dairy and pet treats, whether it's pig ears or chews. And that comes really, really in handy when we at CDC integrate some of our knowledge about the human illnesses and kind of all combine that with our partners. So I think that I am excited to continue that collaboration, harnessing those unique strengths of each of our agencies, as well as continuing to bring in the input from our state and local partners. And so that's something that I want to leave you with is I actually really enjoy and love talking to folks, although I don't tend to get out much. So I would love to continue to be in conversation with AFDO and others, and just really look forward to that opportunity to continue in dialogue. Thank you.
Denise.
Well, as Megan said, I'm sort of going to echo some of the things she said. I have talked today about the changes that we've seen with the new administration and how, it's really making us evaluate everything that we're doing, making sure that it serves the public health mission. But one thing that hasn't really changed is our focus on collaboration. We are always interested in what our stakeholders have to say, whether it's our federal partners here on screen, or it's the regulated industry, consumer groups, other public health partners, states, local, AFDO. I mean, we really want to make sure, as I said, that we're hearing from everybody. So yeah, collaboration remains a focus. I just think it's very important that we all have the same vision, that everyone's food is safe, but we all approach it from slightly different angles. So I think the more we can continue to talk to each other, meet at events like this and IFPs coming up and all kinds of different engagements, that we are constantly communicating, being as transparent as we can possibly be, and sharing information amongst each other so that we can get to the bottom of any acute and emerging issues, in addition to having more long-term alignment on strategies like healthy people, for example. So I'm very happy with the collaboration we have. There's always room for improvement, but we talk with CDC and FDA pretty regularly, and other stakeholders. So long may that continue. Thank you.
Dr. Miller.
I'll go very quickly. I would just say, a renewed focus on ensuring we're eliminating duplication of efforts where unnecessary, really doing risk-informed work. And, just to play on the theme with, collaboration and coalition building, I really also look forward to hearing new and innovative ideas. I think we really are at a time where employing new paradigms to get our work and to get the right public health impact is here. And I look forward to working with all of our federal and state partners to do that, as well as my sister partners in the Human Foods Program.
And definitely not least, but the last participant of our discussion, Kyle.
Yeah, thanks, Steve. Appreciate it. And I also want to just thank Elizabeth, Megan, and Denise for the conversation today. It's always great to be speaking with them and have these discussions across our agencies and department. I think it's just so important to have that level of discussion and collaboration. And, I want to say that our focus on collaboration remains unwavering, as does our commitment to food safety. There's been, discussion at times with the focus on MAHA and the MAHA focus on nutrition and food chemical safety. I want to make clear that we're not taking our foot off the gas at all on our microbiological food safety in any way. That work is our largest risk pillar by both employee count and spend. And, the states, through our partnership and inspection work, are critical to our food safety work. And that will remain a critical pillar for us as we move forward, while we also focus on some of the other MAHA initiatives that are more aligned with nutrition and food chemical safety. So thank you, Steve. Thank you to the AFDO community. We look forward to continued collaboration and very grateful for the opportunity to be here today.
We want to thank all of you for taking the time to participate with us today. This has been a very valuable discussion. We also want to thank you all for doing such a wonderful job leading these programs across the country. Having spent some time with each of you on an individual basis, I have great confidence in where the food safety system in the U.S. is going, and we appreciate your commitment to it. With that, we look forward to seeing many of you next week in person in Dallas. For those of you that don't get to join us, hopefully we'll see you next year in Columbus for the 130th annual conference, which is pretty amazing. With that, we'll go ahead and end this session. This will be made available electronically to all the participants and registrants. So that will be coming out in about 3 or 4 days. So thank you all very much. Take care and have a great day.
Thank you.